Your fixator is going to be on for a long time. To ensure that it stays on without trouble, Pinsite Care is one of the most important things that you should do. Your hands need to be washed thoroughly with soap and water. Don't forget to wash between the fingers. Any ordinary soap will do. You don't need to use any special antiseptic. After washing, dry your hands with a clean towel. You should use only water which has been boiled for 10 minutes and then cooled. Remember, it is very important that these gauze pieces should be sterile. Open up the gauze piece and make it into a strip. It is then soaked in water. The excess fluid is squeezed out, and using this strip of gauze, you have to clean the area where the wire enters the skin. You don't have to be very hard, but at the same time, you have to be firm enough that any scabs that have formed at the area of the skin where the wire enters should be removed. Clean the pin from all the sides by changing the position of your hands and the gauze piece. You must use a new gauze for every pin that you clean. All the wires, that is the thin ones, and the big pins have to be cleaned individually in a similar fashion. Sometimes it can be difficult getting around the pin, but you must take time and clean these areas out well. If some of the pins are painful to clean, you can take your time doing it, but you should clean them. Once all the pins have been cleaned, you can cover each pin or groups of pins which are close together with a single dry gauze piece. Remember, this gauze also should be sterile. You can either tuck one end inside or put a tape to keep the gauze in place. You don't need to use any kind of antiseptic lotion. You don't need to use any kind of ointment or powder around the pins. All pins just need to be wrapped in dry sterile gauze as shown here. You will be able to do a much better dressing than any doctor or compounder. Remember, you can and should wash the leg as well as the fixator. Any doubts? Ask your doctors.